It's 9 o'clock.
A very beautiful morning, dear listener. Welcome to the special health awareness program on Brothers FM 90.5 Makudi. Viral hepatitis is a major public health crisis in Nigeria, which has one of the highest burdens of hepatitis B, HPV, and hepatitis C, HCV in the world. An estimated 20 million Nigerians live with viral hepatitis, yet over 80%, including children, remain undiagnosed and unaware of their status. On this special health awareness program, we shall be looking at preventing mother-to-child transmission and timely vaccination of newborns against hepatitis B in Benue State. And at the right time, we will also open our phone line 0907-333-7045 to take questions, comments, and contributions as well. This program is brought to you by Rise Against Hepatitis Global Initiative, RAGI, and sponsored by the Hepatitis B Foundation through the African Hepatitis B Advocacy Coalition, ABAC. And with us in the studio to do justice to the topic this morning, we have Dr. Iguda Levenus, Medical Director at Moses Oshoadaso University, resource person, Rise Against Hepatitis Global Initiative, RAGI, Benue State. So you're welcome.
Thank you very much.
Also, we have DK Loho Udido Good News, Program and Operation Manager, Rise Against Hepatitis Global Initiative, RAGI, Benue State. So you're welcome.
It's my pleasure.
All right, so we begin like this. First, we'll start with the Operation Manager. Can you introduce RAGI and tell us more about the mission, please?
Thank you so much. Thank you for having me at the studio. I'm very happy to be here. You know, hepatitis is one of the problems that we have in the society. It's a chronic disease. RAGI is a non-governmental organization working to eliminate viral hepatitis through creating awareness, screening. We advocate for vaccination, capacity building. When I talk about capacity building, we are trying to collaborate with the government in many aspects so that we can eliminate hepatitis completely. And possible linkage to care. When we discover that you are positive, we'll link you where they can treat you better.
All right, thank you. That means RAGI is doing so much when it comes to hepatitis, making sure that even people who have hepatitis live better. So now to you, Doc. What is hepatitis B? And why should families in Benue State be concerned?
Okay, thank you very much, our moderator. Thank you, our viewers, as well as our listeners. Generally speaking, infections are major challenges in the African society, particularly the sub-Saharan Africa, West Africa, where Nigeria also fall into. And germs are actually responsible for infections. And there are different types of germs, medically speaking. There are those we call bacteria, there are those we call fungi, there are those we call protozoa, there are those we call viruses, there are those we call rickettsia, etc., which are responsible for causing what we call infection. And those infections are what we call communicable diseases, which means it can move from one person to the other. So in this particular discussion, which is the viral hepatitis, where the cause of the problem is the virus, the germ that is responsible for causing the infection is a virus. And the virus particularly once an individual gets the infection, it affects a very vital part of the body. Everybody knows that the liver is a very vital part of the body, performing several functions at any time, real time. And this virus, once it gets into the body, it has a capacity of affecting the liver. And once the liver is affected, even the common man on the street knows that there will be challenges. And the one we are more concerned with is it has the capacity of progressing. That viral hepatitis, which is the B, which we are focusing on now, has the capacity of progressing to what we call chronic liver disease, what we also call liver cirrhosis, and more importantly, which the general public may not wish to hear, is the liver cancer. So you can now see why the Benue people, Nigerians, and the global society should have a lot of concern. And happily, if the infection is detected early, this chain of chronic infection, cirrhosis, and even liver cancer can be prevented. That is the happy aspect of it.
All right. Thank you so much, Doc. So from your words now, we get to understand that hepatitis B is transferable.
Yes.
So now I ask, how does it how can hepatitis B be transmitted from mother to child, and why is it a major concern?
Thank you very much. As we said, diseases generally, for the purpose of our maybe the public that are hearing us, are classified into two. There's what we call non-communicable disease. There's what we call communicable disease. Our attention today is communicable disease, transfer from one person to the other. So the question you now is, how is it transmitted? How is it transferred from the mother to the child? Usually, the route of transmission is through blood products, and of course body fluids. Blood products, and body fluids. And in pregnancy, the baby remains inside for about 9 months. And during that period, the virus even has the capacity to cross the connection between the baby and the mother and enters into the baby if the mother is positive. That is one. Number two, delivery is always associated with blood loss. And in the course of the blood loss, there is a very high chance of the virus moving from the mother to the baby. And some have even advocated that even during breastfeeding, because some babies suck vigorously, and as a result, some mothers do develop what we call some level of injury at the nipple where the baby sucks, and the blood can also pass through that as is to get into to the baby, and it can also be transmitted to the baby at that level. Why are we concerned? The concern is that majority of the hepatitis B infections globally, not only in Benue, not only in the Middle Belt, not only in Nigeria and West Africa, globally, is as a result of mother to child transmission. So that is why we are really very concerned. And mothers that are hepatitis B positive and they transmit it to the baby has a very high chance of coming down with the chain of chronic liver disease, the chain of liver cirrhosis, and the chain of liver cancer in future.
Oh, all right. I see the importance here. So in mother to child transmission, that's at the level where it is, as the child is tender, it tends to maybe be more dangerous. But in adult to adult, in not a mother to child, to transfer from another, or transmission from someone else to another, how is it, how possible, what are the things, how can you get it?
Yes, thank you very much, moderator. It's not only mother to child transmission as we are discussing, but it can also be transmitted from one adult to the other. And the modes of transmission, as I mentioned earlier, it can be through the blood products, and of course through body fluids. So people that go for blood transfusion, if the blood is not well screened, thoroughly screened, and the blood that is to be transmitted is transfused, is actually infected, it can be transmitted through that. People that use sharp objects, if the instruments, for instance, even if you get to the hospital and injections are being repeated, or needles are being repeated, sharp objects, if an individual that has the hepatitis, the injection is used on them, it can also be transmitted to the other person. And even the tattooing that we see in our community, in our society today, piercing of the ears, that we see use of razor blades by a group of people that are into drugs, illicit drug use. They repeat the use of syringes and needles, so it can be transmitted to that. And again, another important aspect that it can be transmitted is through sexual intercourse. Whether it is heterogeneous, homogeneous, or any form of sexual intercourse, it can be transmitted because of the fluid that is exchanged. When an individual that has the hepatitis B has a sexual relationship with an individual that does not have, has a very high chance of transmitting through that body fluid. We can now see that the blood products and body fluids are routes in which it can be transmitted in adults.
All right. So now, knowing how dangerous it is, the disease is now, we now know the importance of prevention and how to control it. So what are the ways, what are the measures, what are you doing differently, or what do you intend to do in terms of control, prevention, either it's from mother to child or transmission at all?
Thank you very much. That is why we are here. Prevention is always better than cure. And from what we've discussed so far, can be prevented from transmission of the infection can be prevented from mother to child. And what are the ways? Number one is to have that information that hepatitis is a challenge in this our environment. And that is why Brothers FM is making the public to be aware that this is a global challenge. It's a Middle Belt challenge. It's a West African problem. It's a Benue problem. It's our problem. So that awareness is important. Number two is to be aware of the fact that screening is key. What do we mean by medical screening? Medical screening is looking at the person and say, okay, come and check for this test, even though that person does not even have signs and symptoms. Okay. The person is healthy, is moving about, is doing his daily activities, but to say, okay, come, let's check you for hepatitis, let's screen you. So that screening, the aim of the medical screening is for early diagnosis. And early diagnosis is key to treatment and even cure. Okay. It's key to treatment and even cure.
So it's curable?
It's curable. It's treatable. It's treatable. It can be well managed at this level. So we'll get to the level of the cure later. Well, okay. It can be well managed. So the mothers, while the public awareness is going to that we are aware, and every mother that pregnant woman must be screened for hepatitis. And why they were here more is targeting the traditional birth attenders. For autonomous medicine is conventional for us. Any woman that is coming for antenatal must be screened for hepatitis B. It's normal. It's a conventional thing we do. However, the traditional birth attender, you know how important they are in our society. They are opinion leaders. They are well respected in the community. They are community leaders. So the women have a lot of respect for them, and a lot of the pregnant women go through them. But we have noticed along the line that they don't go through the screening for hepatitis B. As a result, a lot of them go through the antenatal clinic period, go through the delivery without knowing their status, the hepatitis B status.
Oh, okay. So at what stage is a pregnant woman supposed to be screened? Is it the first trimester of the pregnancy? So at what stage?
Immediately the woman presents for antenatal clinic is supposed to be screened immediately.
Okay.
So that is the first trimester. That's what I say. If he gets pregnant, the pregnancy is established, and the doctors or the traditional birth attenders is aware that this woman is pregnant, the hepatitis screening is supposed to be done. So that is at the level of the pregnancy. Okay. But we are saying generally that it should extend beyond the pregnancy, that everybody actually, you and I, also supposed to know our hepatitis.
Yes,
status.
aside and other people's also getting them to know the importance of getting screened and at the right time, even if you don't have symptoms, so that you can check your body and then get the treatment, like you said. Then from the mother to child, we're also concerned in that aspect, because at the point where they are screened, what happens next? How is the child being protected from the mother being from the virus to be transmitted to the mother? Are they medicine, vaccination, or what?
Thank you very much. I think that is part of an important aspect of why we are here too. So we are encouraging traditional birth attenders, particularly, and the general public, that once a woman is pregnant, the woman should be encouraged to do the hepatitis B test, which we call hepatitis B surface antigen test. Once it is done and is positive, there is a red alert already. So the woman should be encouraged to now get to a proper health facility if it's the traditional pet attenders home, which they may not have the facility to adequately take care of the baby, of that. They should refer the patient to the nearest health facility, which the woman will be followed up. And at birth, as she delivers, within the first 24 hours, the health facility are already known that the baby is supposed to go through a vaccination process. Vaccination or immunization is a process of protection, protecting the baby from coming down in future. In fact, it's a preventive measure. It's a major preventive. So it will prevent even if the mother of the baby is hepatitis B surface antigen positive, with adequate immunization and vaccination and other medical care, the baby is expected to be free from it. So that vaccination is key. That is the target. But in case, as I said earlier, because of the trust our people in the community, in Nigeria, in the villages have on the traditional birth attender, they may not wish to go to the health facility, no problem. But we are saying that the traditional birth attender should be aware that this particular woman is hepatitis B positive. It's hepatitis B surface antigen positive. So immediately it delivers, even in the traditional birth attender center, the traditional birth attender should quickly move the baby to a facility where that baby will be vaccinated and subsequent vaccination given to prevent the baby from coming down with chronic hepatitis B infection.
All right, Doc, from my understanding, are you trying to say that through pregnancy, a child cannot be protected from the mother? It's after birth that the child gets to be vaccinated and then protected from the hepatitis B?
That is a very good question. Usually, as we established earlier, that the virus can actually move from the mother to the baby through the placenta. So if that is the case, can anything be done at that level?
Yes,
to also prevent the virus from entering into the mother
while the child
is still within the womb? Yes. That is why it is important. That is why we emphasize that first point. The first point is that once the woman is established to have hepatitis B surface antigen positive, it should move to the nearest health center, where appropriate intervention will be given to the mother to help in the transmission. But that level now, it has to be a specialized type of care, because some of these medications that will be given, the baby is inside.
Yes.
So the adverse drug reaction can also affect the baby. So it's a specialized type of healthcare delivery, which the traditional birth attender may not be able to handle, which even the primary healthcare center might not be able. So once that patient is identified, it should be referred to a tertiary health facility where experts will look at it conclusively, weigh the options that are on the table, and make sure that appropriate interventions are instituted.
Sure. It therefore means that it's a very critical issue here.
Yes.
Because once a pregnant woman is identified to have a hepatitis B, with the traditional birth attendant, I think the right thing to do is to refer them to a health facility that has the capacity to take care of them.
Yes.
Since it also starts during pregnancy,
yes,
than to wait till they deliver.
Yes.
So I think you should put the message out there clear and then direct them on what to do exactly in such cases. Then we'll move forward, please.
Thank you very much. That is actually the first line of thought. Once a woman is established to have hepatitis B surface antigen positive result, the woman should be referred for a specialist care. That is the point. Because the care, a specialist care, will increase or decrease the incidence of the baby coming down with the hepatitis considerably. That is the first and the most important point. But when we generalize like that, we're also careful. Because we are in Nigeria, whereby we have been a frontline physician who has actually been in this field for some years now. We are aware that even though you try your best to encourage the woman, yes, the traditional birth attender say, okay, madam, this is the issue, you have hepatitis B. Move to this center where you can get the best. Take, for instance, the woman is in Zakibia. And you know that the only place you can get this treatment is in Benue State University Teaching Hospital or Federal Medical Center. So the woman who are looking at the economic situation of the country, looking at the economy of the child, of the mother, looking at the situations, right, the security situation, the woman may opt out and say, no, traditional birth attender, continue. I will not be able to go to this particular facility to do that. That is why that option B actually came in. That is a situation where we cannot achieve option A, which is moving the woman immediately to the specialist center for care. Then the traditional birth attendant can still go ahead and deliver the baby. Immediately the baby is delivered, that baby must be moved to the primary healthcare center closest to them for the vaccination within 24 hours.
All right, thank you so much, Doc. Let me leave you to catch breath a little. So the operation manager, back to you now. Why is RAGI focusing on preventing mother-to-child transmission of hepatitis B in Benue?
Thank you so much for that question. You know, Doc, I've said a lot, but I have to say something. You know, mother-to-child transmission is one of the major ways, as you can hear Doc saying, is one of the major ways of this chronic hepatitis B infection. Preventing infection at birth protects future generation and contributes to hepatitis elimination goals. You know, it's like Rise Against Hepatitis, we are trying to do with we are trying to start from the grassroots. What do I mean by that? We are targeting the unborn children, those babies that, as the doctor is saying, we are targeting them because we know that there was one research, I came across one research, they say that China were also very high. Their hepatitis level, their hepatitis status was very high some years back, but they followed this process of vaccinating every newborn baby within 24 hours, and they somehow, let me say, they eliminate it, if not 100%, but they defeated the hepatitis. They are the same way we are trying to follow. That's the reason why we are focusing on preventing those newborn babies. That's why RAGI is interested in them. You know, if we keep protecting those babies, every woman or every pregnant woman adhere to the rules, or let me say, follow the right path that she's supposed to follow. At the end of the day, yes, Nigerian antenatal, at the end of the day, you realize that we have a free hepatitis generation. So that's the reason why we, RAGI, we focus so much on mother-to-child transmission of hepatitis B here in Benue State.
All right, thank you so much. So what are the activities RAGI has carried out or is doing? Is there any projects, is there anything RAGI is doing or has done in this regard so far?
Thank you so much for that question. We have done a lot here in Benue State. We have done a lot, but I will be focusing on this current project. The reason why I said we focus on this current project, this mother-to-child transmission, I will focus on this project, but RAGI have been doing a lot here since our inception to 2024 here in Benue State. Currently, some of the activities that we carry on here is that early February, that was the beginning of this project. We trained volunteers, people that they volunteer with us. They act as advocacy. We give them proper training to advocate, even on the road, in their churches, wherever they are. They should give the right information to people. So that was the aim of training those volunteers. We train them, we give them training so that they can act as advocates on behalf of Rise Against Hepatitis. We provide them with the right information, with some pamphlet and a lot of that. So we have those volunteers. They are committed to us. We have them under our canopy, and they are doing the work. Secondly, we also train health care workers too. Here in Benue State is another achievement. We go ahead, the traditional birth attendants. You know, Doc focused so much on traditional birth attendants. He has his reason why he focused so much on them. There is something, this is where I'm from. I'm from Benue State. I know those people in the village or those people at rural areas. I don't want to use the word village. Those people at rural areas, you know what they are, when they have believe those traditional birth attendants so much. Sometimes when they have problems, they say that if we go to Benue State University, they'll start calling huge amount of money for you. It's something that if I meet this social woman, if I meet this social man, I will pay less and he will treat me. I'll be very fine. Those drugs, there was a time I was sick here. He gave me drugs. They directed me, they do this one for me when I get to Benue State University, Makurdi.
Herbs.
It was the same thing, yes. It was the drugs, they did not even change. Like, they had a lot of, like, they tried to make those people look, I don't know. You understand what I'm saying?
Yes, I guess, and I understand that
Yes,
they're
so-
one of the major people in this hepatitis B transmission we are talking about.
Yes,
so
because we are dealing with the pregnant woman.
Yes, I want to also quickly add that, so in talking about this traditional birth attendants, what success have you recorded so far with them? How have you been able to put them under one house and then make them understand, let them see the need to then work well with health facilities in terms of referring a patient that has hepatitis B for the person to get the desired care?
Okay, thank you so much. That was where I was heading to.
Okay.
You know, that was the reason why we gave them training. We called them here in collaboration with Benue State Ministry of Health and Human Services.
That's for the whole state?
Yes, we
Okay.
bring them, some of them, not all of them, but we tried as much as possible to train up to 30 of them. So we did it in collaboration with Benue State Ministry of Health and Human Services. We trained them, and also government personnel. There are some government personnel that they attended. They really appreciate our work. We are also engaging with, I'll answer you properly, but I haven't finished when you asked me our activities here in Benue State.
Please, go
yes.
ahead.
So the community engagement, we engage with a lot of people in the community. We have some advocacy meetings together with the Benue State government. We do some screening programs. We do some campaign. And overall, we have a partnership with Benue State under the Ministry of Health and Human Services, signed by the commissioner. We have the partnership. The partnership is to strengthen our relationship with the government. So those are some of the activities that we have been doing here in Benue State. And the response from the traditional birth attendants is very positive. Like, I'm really impressed. After the training, as a program manager, I went ahead and created a WhatsApp group for those of them that are on WhatsApp. You know, it's not all of them are on WhatsApp. And those ones that are not on WhatsApp, I'm having direct calls with them. And I gave them my number to call on me anytime they're in need of me. Most especially, you know, when Doc said something here that I want to key in. He said that our economy is another issue. So this referring, sometimes they will refer them, those pregnant women, they will refer them to a better hospital, but they will not go because of the economy. And that is where, and sometimes they need to have a vaccine within 24 hours after birth. Some of them, they cannot, because of the economy, because of their financial constraint, they cannot make it. That is where Rise Against Hepatitis key in. We told them that whenever they refer someone, the person is not capacitated, call on us. We'll provide, we'll support them with funds to go to the hospital. And we have been doing it already. Even here in Makurdi, there's one hospital that we facilitated. No worry, I will come to that. But there's one hospital that we give them keys for testing and the rest of that. So the woman deliver. They called me that the woman said that she doesn't have money to went to teaching hospital for the vaccination, for the vaccine. I have to send the transport so that the woman will go there.
All right. Well, good one. That's very good. That a follow-up it was done and is still on to see that what you've planted really grows and you achieve the result you desire to achieve. But I was is Raggy present in all the 23 local governments of Benue State?
You know, the fact is for now we are working with selected local governments.
Could tell us the local government so that
yes,
we know.
We are working with selected local governments. We are working with Buruku local government. Taka local government, Makurdi itself, and Gwe East.
Okay.
These are the
3 local government.
4.
Okay, 4.
Yes, I say Buruku, Taka, Makurdi, and Gwe East.
Okay, Gwe East.
Yes, those are the local governments we are working with. The reason why we choose those local governments is not because it's not really fair or whatever. We look at Makurdi as a metropolitan, where people from all local governments are here. So we choose Makurdi. And Buruku local government, according to the research that I got from Benue State Ministry of Health and Human Services, Buruku was having the highest number. So there was every need for us.
Research on what? Hepatitis B?
B, okay. Hepatitis generally, B and C.
All right.
Buruku was having the highest according to what I got from the ministry. So that was the reason why we start with Buruku and then other local governments. But we are trying our best to spread to other local governments too. And those local governments...
So you're taking turns?
You see?
You're taking turns. After you're done with these 4, you move to next 4? Or
yes.
Like you register your presence in these 4, is established, then you move to other local government until you cover Benue State.
Benue State, that is our mission. That's what we want to, if possible. And those local government that we have 3, we choose 3 facilities in each and every local government. Buruku local government, we have a general hospital. General Hospital Buruku. We supply them with testing kits to be testing those pregnant women free.
Okay.
Yes, and we give them a record sheet where they will record it. If it's positive, record. If it's negative, we'll record it. We have a Mhono clinic, also in Buruku. We have a Zembe clinic, also in Buruku. Here in Makurdi, General Hospital, North Bank, we give them keys to test pregnant women free. We'll have a Foundation Hospital at low level. We have a Rizwan RCCG clinic around Boku Road, Redeem. They own it's a kind of maternal clinic. So we look at it as a good area. So we give them keys to carry on the test for free. Coming to Taka local government, we have General Hospital Taka. We have NKST General Hospital, Wanune. We have St. Christopher Hospital, Anune. Go to Gwe East. We have St. Vincent Aliede. We have General Hospital Aliede and the primary health clinic Aliede.
All right. Okay.
Yes, so we give them keys to test them for free, test those pregnant women for free. And if anyone, so that we're doing follow up, not just test them. After testing them, we'll do follow up. Those ones that they test them, we feel like they are committed with us. We'll be calling you, asking you, we have your EDD, that is expected date of delivery. So we'll be following you up. And if any of the hospital is out of the vaccine, then you refer to the other general hospital. Mostly they always have it. So we refer you to those places for proper vaccination.
Thank you for the explanation. I was going to ask Doctor, when he kept mentioning Federal Medical Center and Teaching Hospital, I was going to ask, are those the only facilities capable of giving the vaccine or treatment of hepatitis B in Benue? But as you mentioned, the kits, I know that general hospitals are also equipped to handle them as well. So, Doctor, quickly, just what are some common myths about hepatitis B that should be corrected?
Yeah, very important question.
And I want to also add, apart from the can helps, is there anything also be taken in treatment of hepatitis B?
Okay, thank you very much, moderator. A lot of people have a lot of interpretation and mindset concerning the etiology, what we call the etiology, the causation of hepatitis B. A lot of people believe that it's witchcraft and witches that are actually responsible for the transmission of hepatitis B. You know how much we are deep into our tradition in this in the West African region, and a lot of people also believe that through the food, when one tastes dirty food, food that is contaminated, not clean food, not clean water, also can also result to that. A lot of people say once you visit village, village people will give you hepatitis B.
Doug, please, before you conclude on what you say, I just want to remind our listener that you can call us and then be part of the program. Ask your questions, comments, and contribution here on Brothers FM 90.5 on this health awareness program. 0907-333-7045 is the number to call and be together with us here. Doc, you can go ahead, please.
Okay, thank you. So a lot of myths are around it. Those things are just a conception in the minds of many people. We have established here that it's a viral infection. And the virus responsible is a hepatitis B virus. It's a germ that is responsible for causing the infection. It's not food, it's not witchcraft, it's not village people. Those people are not responsible. Then concerning the herbs, in African society, there must always be a way of looking for solution. People always look for solution. So a lot of herbs are there in villages, in hamlets, even in the major town they are there. But scientific evidence has shown that they are not really very helpful in the treatment or management of hepatitis. So any patient that has a hepatitis should visit the health facility for proper care and treatment.
All right, thank you so much, Doug. I'll come back to the operational manager. We understand that some babies have already benefited from this intervention. Can you tell us more, or what, and also include the challenges Raggy has for carrying on this project so far?
Yeah, thank you so much. We record a lot of success because first we screened pregnant women. Pregnant women have been screened. Newborns delivered by participating mothers. As I earlier told you, those mothers that we screened in, we feel like they have something to do with us. We must make sure, we must follow you up to delivery. So newborns delivered by participating mothers have received hepatitis B vaccination within the critical first 24 hours after birth. As I was telling you earlier, that there was one here in Makurdi, not only one, that they complained that they don't even have the fund that will take them to the general hospital, to teaching hospital, where they can have the vaccine with key in. So pregnant women have benefited already. And I can tell you, yes, the challenges we have, we thank God so much because it's a success, because of the state government is ready to collaborate with us. When you're talking about health, you cannot go with our state government. They're the one that they control the primary health clinics, they're the one, the general hospitals, which carry the highest population of pregnant women, patients like that. So they are open to us, they are ready to work with us. That's the reason why we have a memorandum of understanding with them. So, but there are some challenges that we face. Limited access to vaccination, I will put it that way. That is the number one challenge. As I am saying, there are some hospitals, those private hospitals, they don't have the equipment, or let me say they don't have the equipment needed, like a freezer where they can keep the vaccine and stuff like that. So they have to go to the general hospital, and sometimes there's no proximity between the general hospital and those hospitals. So limited access to vaccine is a number one challenge that we have so far. Then secondly, another big challenge that we have is health workers in the immunization unit. That's how they call the immunization unit. Health workers are these units don't come to work during weekend.
Okay.
Yes.
And public holidays or just weekends?
Weekends, and let me talk about weekend because that is what I know very well. During weekends, they don't come to work. So there's a gap, G. If, for instance, you need to vaccinate your baby within 24 hours, so your baby born 11 o'clock on Saturday. So from 11 o'clock to Sunday, 11 o'clock, that's 24 hours. And those people don't come to work during weekend. This immunization unit. But we are still hoping, because we discussed it with the state government, the Ministry of Health, they are ready to collaborate with us so that Raggy can come in and they'll do something about it. We are looking how we can go about it, and those people start coming to work.
Or make available the vaccine at every health facility.
Good, so that the challenge will not be there anymore. And I can say finally, means of preserving the vaccine is another challenge. That is another big challenge that is facing there, because if those private hospitals, I'm very sure, if they are capable of having things to preserve the vaccine, they'll go ahead and do it. And Benue State now has ravaged with insecurity. These are some of the challenges that we face during this project.
All right, thank you so much, Operational Manager. So, Doc, back to you. Apart from the newborn babies, who is qualified to be vaccinated? Where can they get a vaccination, and what's the process?
Okay, thank you very much, Moderator. Once, apart from the newborn babies, because even though our target is on the newborn baby, but I thank you for the way you are looking at it from a general perspective. From the newborn baby, anybody that has gone for the screening and is negative, the results say negative for hepatitis B surface antigen, the person actually supposed to visit the closest health facility and present the result to them, and the health workers will know exactly what to do, take it up from there.
All right, but if the person is tested positive, go to a health facility and get treatment.
Exactly.
All right, 09073337045 is the number to call. We are almost at the last lap of our program. If you have questions, comments, or contribution, then you can join us. I'm still with you, Doc. I wish to know, do you think the Benue State government should make hepatitis B testing a compulsory part of antenatal care for all pregnant women?
Yes, thank you very much. It's a very, very good question, because the target of the program is prevention. And we have earlier established that prevention is always better than cure. As I mentioned earlier, facilities that are mounted by health workers, once a woman is pregnant and it comes to the facility, hepatitis B surface antigen must be done. Test must. That one is conventional, is established. But the challenge is on the aspect of the traditional birth attendant and some of the pregnant women that may not even wish to visit any facility. So that is why that question now becomes very important. Everybody actually should be screened for hepatitis B surface antigen. Everybody in the state.
All right, thank you so much. So, Operation Manager, I understand that Raggy has done so much and have done well, and is still doing and intends to do more. Can you put us through the vision for the future of hepatitis B prevention in Benue State for Raggy?
Okay, our future is very straight and is a very straightforward. A future where every pregnant woman is tested, every newborn receives timely vaccination, and no child becomes infected with hepatitis B at birth. That is the future we're looking at.
All right, thank you so much, gentlemen, for coming on this health awareness program today. So our time is almost up. I would like you quickly put it to Doc. Please, can you, one breath, wrap up your thoughts and your advice to Benue women, to Benue State in general?
Thank you very much. Thank you, our moderator. Thank you, the viewers and the listener too. The summary of what we are saying is that hepatitis B infection is a problem to us in Benue State here. It's a problem to North Central Nigeria, West African sub-region, and Sub-Saharan Africa. And luckily for us, steps to be taken for prevention are available. And the step is that, number one, we must first of all have this awareness, which a broader is helping to bring to this general public. Number two, the screening. Everybody must be encouraged to screen. It's not only the pregnant women, everybody must screen. After the screening, those that are negative should aim for prevention. Visit the nearest health center where vaccines will be given to continue to protect them against hepatitis B. Those that are also positive should also visit the nearest health center so that assessment can be made early for the prevention. Because if nothing is done about it, particularly among those that are positive, they may lead to chronic liver disease, and the one we are not comfortable with mostly is the liver cancer.
All right, thank you so much, Doc. Operational Manager, your closing thoughts, please.
As I earlier said, the future, what matters is the future where every pregnant woman is tested, the girl should be screened, and if they are screened, we'll refer them or we'll link them for care, that is treatment. We'll keep working together to to have a free hepatitis ward or free hepatitis Benue State or Nigeria at large. Thank you so much.
All right, thank you so much, Operational Manager. We've been speaking with Dr. Iguda Levinus, Medical Director at Moses Oshiadase University, Resource Person, Rise Against Hepatitis Global Initiative, Ragi, Benue State, and as well as Deke Loho Udido Good News, Program and Operational Manager, Rise Against Hepatitis Global Initiative, Ragi, here in Benue State. And we appreciate you for staying tuned. We'll also give thumbs up to the sponsors of this program, which are Hepatitis B Foundation through the African Hepatitis B Advocacy Coalition, ABAC. Thank you so much, gentlemen. And this is where we call it a wrap on the program for today on Brothers FM 90.5 Makodi. Until next time, we shall bring your way an interesting package on health and other issues. My name is Happiness Kia. Very many thanks for being part of the package.
You are in tune with the station that is sunny side up all the time. The station with more variety of music than any other. Rocking the airwaves to bring a little bit of magic into your life. We are Brothers FM 90.5, the station of the moment.